Hi everyone, welcome to the session on nappy changing and toileting. So we are holding this session with myself, Tanzina Billah, the facilitator and the trainer, and Tasina Billah, senior educator and team leader at Good Start Early Learning and casual employee at Good Start, Mr. Nazmul Saqib Khan. So we are doing this session today as a part of Nadmus's induction at Good Start Early Learning. And I'm using a Microsoft PowerPoint presentation for this nappy changing and toileting procedure. So let me get the presentation first and share my screen with you. So please confirm whether you can see the screen or not. So I have shared my screen. Can everybody see?
Yes.
Yes. Yes. Okay. Thank you very much. So I will turn the slideshow on right now. So can you see the slideshow? Everyone?
Yes.
Okay. Good. So this training session is a part of the unit CHCECE 005, which is titled Provide Care for Babies and Toddlers. So we will directly go into the nappy changing procedure because Nazmus, I know that you have already done 3 months work at a family daycare and you need this as a refresher for Good Start Early Learning. So let's get on to the nappy changing procedure, which is we have to ensure all supplies needed are close by while starting the nappy changing procedure. Then we have to use the disposable gloves all the time. And if a nappy change bench is not available, we can do it on the floor with using a floor mat. In the case, but we have to ensure the dignity of the child. And in the case where change benches are available, we will guide and encourage older children to use steps or ladders provided to climb up onto the change mats. This will further independence skills and is in accordance with manual handling lifting procedures. So you have to lift the child and raise up or down, put the child down, maintaining all the safety and proper manual handling procedures so that you don't have sprains or strains on muscle pulls or muscle aches. Okay. Then we have to dispose of the nappy immediately in the nappy bin. We have to use a pedal bin in this case because pedal bins help us avoid all the hand touching thing. And then while changing the nappy, we have to use disposable wipes to wipe the child's bottom. We have to raise the child like this and dispose of wipes into the rubbish bin. Then we have to remove gloves, but we have to be very careful. We cannot remove the gloves with our bare hands. We have to remove the gloves with one hand with the other. Yes, Tahsina?
Yes, just I want to add that on your first point, you wrote that ensure all supplies needed to change the nappy are readily available and close by. This is very important because if we see that while changing the nappy, the gloves are not there, or the nappy, the new nappy is not there, then we cannot run, keeping the child there in the middle. So we cannot run and take the supplies from wherever they are available. So this is very, very important in terms of safety and security. And sometimes it happens that when the nappies leak or when we are dealing with accidents while we do the toilet training for the children, we have to get ourselves prepared with the bag of the child with the extra dry clothes and shoes and socks that are being provided by the parents. So we cannot run for the bag in the middle of the nappy change or in the middle of dealing an accident incident. So this is very important. All the supplies as well as the bag of that particular child needs to be gathered beforehand. So this is very important.
Yeah. Thank you very much. That was a very valuable point, Hasina. Thank you. Then we have to put hand between the child's skin and nappy before inserting pin. Sometimes parents prefer cloth nappies to be used. In that case, we have to put pins, and we have to be very careful while inserting the pin so that it doesn't hurt the child's skin. Yes. Hasina first.
Sorry, I did not.
Okay. Najmus, please.
I think the slide's not changing.
Oh, okay. Now you can see the change? Yes?
Not yet. No.
Not yet.
Okay, let me go back and share. Stop sharing and start sharing again. So can you see it now, Najmus?
Yes. Toileting
procedure slides.
Toileting procedure. So.
Is it changing now?
We are watching the toileting procedure, but we are yet to come to this slide. I think there are some slides missing in between.
Oh, okay. I don't know what is happening here. Let me see. You can, okay. Can you see now, please?
Yeah, I am toileting procedure. Yeah, again, toileting procedure. Yeah, nappy changing. Yeah,
that's. I think slideshow is not working. Okay, never mind. I'll do it like this. So thank you for telling me about this. Then we have to put on a clean nappy, then remove child from change mat, and then use steps where possible. And then sanitize change mat with detergent, sanitizer, and wipe over with paper towel, dry with paper towel, and dispose paper towel in rubbish bin. And then we have to wash hands, but the thing that Hasina has mentioned, we should never leave the child unattended on the nappy change table. And while we are changing the nappy, we have to put one hand on the child all the time. And while we are changing nappies, we should try to talk to the child or sing or communicate so that the child cooperates and helps us do our work smoothly. And then nappy changing routine should be distributed between staff so that one staff is not burdened with all the nappy changes. And children are to wash their hands after nappy changes, because sometimes, very often, children are seen to touch different parts of their body while we are doing the nappy changing. So we have to ensure that they also wash their hands after the nappy changing procedure. When the child is grown up and he or she starts practicing nappy toileting at home, then yes, Hasina?
Yes, just I want to add something on that distribution of nappy changes, number of nappies need to be changed. This is also very important from the Good Start point of view, because throughout the day, one room might have 20 children, and throughout the day that room, those 20 children need to be changed for 4 times maybe, because we maintain
roster for nappy changing.
Yeah, roster, and we also encourage educators to check the nappies in every 2 hours and change accordingly. So there will be, suppose there is a room with 20 children, so there will be 80 times a nappy change. So if we put one educator for all the 20 nappies to be changed, then it will be very difficult for her. So we don't want, Yeah, so what we need is we don't want to burden one educator with all the nappy changes. So instead we just do it, distribute the number of nappies among the educators. Suppose if there are 3 educators, then 20 nappies
6 nappies
distributed.
for each
Yeah,
educator.
6 nappies per educator.
Mhm.
And that's how we encourage from the safety security of our educators. So that's, and as well as ensuring that our client, the child, is always monitored, and they don't walk or run with the filthy nappies
Okay.
and have a nappy rash.
Oh,
So
okay.
that's our procedure. Every 2 hours that needs to be changed.
So Nazmus must be happy hearing that even if you are training, you are not going to be burdened with changing so many nappies. Okay, so that's good news. Then we come to the toileting procedure. So how are we going to know when the child is ready for toileting training? So there are 3 factors that we have to consider. First one is toilet training, parent and staff discussion. So parents are going to inform the educators that they have started toilet training at home. So children will be encouraged to do the same at the center. Then maturation of central nervous system in individual children. So that means children are grown up, so they understand that they have to use the toilet. So they accept the fact and they respond when we are trying to train them. And then cues from a child, that is, a child is pulling at nappy and frequent dry nappy. So the child understands that he or she should not do the toilet in the nappy. So he or she should use the toilet instead, not poo in the nappy or something like that. Okay, and then staff are to show patience, as toddlers often have toileting accidents. This is a very important part of toileting, that children have accidents when they have started toileting just new or fresh. So we should be very patient, and parents are advised to bring extra changes of clothes, including shoes and socks. All wet and soiled clothing is to be rinsed and put into a plastic bag, then returned to the child's locker or bag to go home. Simple rules of hygiene are to be encouraged, hand washing, etc. And children using the toilets are to be supervised at all times and assisted with toileting routines such as wiping bottom, pulling up pants, washing hands, etc. so that they don't forget. And next is, now we come to the part where toileting procedure is like staff will encourage children to flush the toilet, and then staff will assist children with toileting as required, ensuring they use gloves and wash hands, and staff will monitor children's use of toileting facilities, and staff will encourage children to toilet at regular intervals throughout the day, and staff will ensure children are encouraged to follow high hygiene practices. Now these are the 2 posters that I'm going to show to Najmus specially. Najmus, can you see my screen still? Any problem? Najmus?
Yeah, I can see it.
Okay. Tasina can see?
Yes.
Okay, thank you. So we have 2 posters here which are frequently seen at childcare centers. One is the how to hand wash. So it is made by World Health Organization, and the other one is changing a nappy without spreading germs, whatever we have discussed so far. So it was published by National Health and Medical Research Council in Australia. So these 2 we can follow if we become confused about something. Then how to handle a toileting accident. This is very frequent when we start to toilet train a child, and staff will show children respect in all situations, and staff will ensure the area is cleaned thoroughly. Then staff will assist children in cleaning up and changing. Staff will follow correct hygiene practices, wear gloves, disinfect affected areas, etc. And staff will rinse soiled clothes and put in a plastic bag for collection at the end of the day. So toileting accident, we should be very patient with the children. We should not shout at them. We should not say bad things at them. Then they will be encouraged to resume the toileting procedure. And last, that brings us to the end of our session. But before we go, I would like to ask Najmus one trivia to see how he understood the session. So my question is, can you recall the 3 factors that determine a child's readiness to use the toilet? So can you answer that for me, Najmus, please?
So as far as I remember, the first one was, the first factor was parent and staff discussion. So that toilet training it needs to be consistent with what's happening at home. The second factor was the maturation of the central nervous system in individual children, and number 3 was receiving cues from the child, such as them pulling at the nappy or frequent dry nappies, etc.
Thank you very much. That was excellent, Najmus. You have rightly told me the 3 factors. And last of all, I would like to ask, invite questions from you guys regarding this training. Like, do you feel anything should be added to this training to make it more effective or anything like that? Or do you have any specific suggestions or recommendations for me?
I think it's pretty sufficient information that's been provided in the training.
Okay, thank you, Najmus. And Tasina, what do you think?
Yeah, I think the training is informative, very informative, and very thoroughly explained. So as a newcomer like Najmus, it's gonna be very helpful to deal with the nappy change activity of good start as per the policies and procedures and following all the benchmarks. So, and also about those posters, that hand washing and nappy changing posters, we provide in our toilets, we provide those posters. We just stick those posters wherever applicable within the toilet, so that the educators are actually with the parameters all the time when they're doing the work. So they can follow, they can quickly check as a checklist. They can quickly have a check, even because we are human beings. Sometimes we deviate, and sometimes we forget to follow the steps. So we put those posters in our toilets in order to have them a glimpse while they are doing those works, and check whether they are going accordingly. So
doing it in a compliant way.
Yeah, compliant. And with all those helps or all those assistance, I think it's gonna be pretty easy for newcomers like Najmus to do the work. So it's the training, it's the posters, and even from the colleagues, the senior colleagues can also help while doing the job. So it's gonna be it's not gonna be a problem. And
thank
definitely
you. Thank you very much, Tasina, and thank you, Najmus. Thanks, guys, for attending this training session. And you have provided valuable feedback, and we have come to know of many useful information regarding childcare activities. So thank you very much. And this was the theoretical session, and while we will do the practical session of nappy changing next, while you will also be there, Tasina and Najmus will be there, joined by another learner. So until then, see you guys. Have a good night. Thank you.
Thank you. Bye.
Bye.